Okay, we're looking at the skull anatomy. And so what I want to do first is go on the inside and look at what's on your lab guide first, which are cavities, fossae, and sinuses. Okay, so large cavity, that's this space right here and here. This is the brain cavity. So this is the largest cavity here of the skeletal system. This particular cavity is broken up into sections. So you have fosses. These are depressions. This is anterior, middle, and posterior fossa. Each of those is a fossa. That's singular. Fossae is plural. Okay. Inside this cranial cavity, not only are you going to have the brain, but you're going to have blood supply and blood that will leave the brain. So when you bring it up, then you've got to take it away as well. And so there are grooves along the inside that allow for the space for those dural sinuses. Dural referring to the membrane that surrounds the brain. Sinus is a space, and so these are the venous or veins. So that's going to be deoxygenated blood that will leave the brain and go down into the jugular vein back to the heart. Okay, so here they're pretty distinct in this model. In this other model, they are colorized. So you can see that they go down to the jugular vein. Some other cavities of the skull, the orbits, okay, where your eyes are going to be, the nasal cavity, and the oral cavity. The oral cavity is also called the buccal cavity, okay, B-U-C-C-A-L. You also have some much smaller cavities, which are going to be middle and inner ear cavities, and those you're going to see on a model like this. You're not going to be able to cut open the skull and see that. So this is the exterior portion of the ear. This is the middle ear cavity where those auditory ossicles are located. And then this, this is the cochlea and the vestibular structure. This is the inner ear. So this is where all the neurons are collectively. They converge to form a nerve, and this is going to take information to the brain about hearing and equilibrium. I'll have to come back to the sinuses because I forgot to put my flat panel model up here. So let's skip on through, and we're going to go through now each of the cranial bones and the facial bones. We're going to start with the cranial bones. Large bone up here in the front. This is the frontal bone. This has a couple of features. The supraorbital margin right here. So this is where your eyebrows would be located, just above. Some of you have looked at the holes, the supraorbital foramen, which is a hole there. Okay, that's not on your lab guide, just FYI. On either lateral side of the skull, we have the parietal bone, and it is separated down the middle by the sagittal suture. The parietal bones are separated from the frontal bone by the coronal or the frontal suture. The parietal bones are separated again from the occipital bone, which is back here at the posterior, by the lambdoid suture. And one more suture, the parietal bones are separated from the temporal bone by the squamous suture. Okay, so the parietal bones have a few features aside from all of these sutures. The temporal lines. Temporal lines extend over the frontal bone through the parietal bone, and they stop just a little bit shy of where the occipital bone would be. And so this is an attachment site for the temporalis muscle. If you take your fingers and place them up on the side of your head like that, and you clench your teeth, you can feel that muscle pull on the bone, and that creates those temporal lines. That stress of the bone being pulled by that muscle causes it to develop and grow more, so then the lines become more distinct over time. The occipital bone, the posterior portion of the skull, has several features, including nuchal lines, which are attachment sites for muscle. So there's one across here and one a bit lower. And within this one nuchal line, you see a bump. This is the occipital protuberance. So this is also an attachment site for muscle. Many of us might be familiar with it if you've gone to the salon, you put your head in the shampoo bowl, you get up and you rub the back of your head like, ow, that hurt. It's because you were resting your head on the protuberance, which was resting on the shampoo bowl, okay? So that's why that hurts. If we go a little bit more to the inferior aspect of the skull, looking at the occipital bone, you can see the occipital condyles. So these are rounded surfaces that allow for articulation with another bone. So the occipital bone is going to articulate with the first bone of the vertebral column. This large hole right here is called the foramen magnum, and this allows for the passage of the spinal cord down into the vertebral column. On either side of the foramen magnum, there's a small hole called the hypoglossal canal, and this allows for the passage of the hypoglossal nerve. Looking at the lateral aspect of the skull, we're going to focus now on the temporal bone. Temporal bone has quite a few features to it. First, this bone allows for the connection of the mandible. So that's where your joint is, the temporal mandibular joint. It's where the mandible meets the temporal bone. So where it articulates on the temporal bone is called the mandibular fossa. Fossa is a depression. Just posterior to that fossa is a little spike. It's a bony spike, and this is an attachment site for a muscle as well. This is called the styloid process. And back even further, you can palpate the mastoid process right behind your ear, that bony structure. This is also an attachment site for muscles. Muscles that go to the jaw, muscles that go to the neck. You can also see on here the external acoustic meatus. So that's the hole right there that leads into the ear. And on the inferior aspect, we can see a couple more holes, 2 more holes. Let me move this. See the jugular foramen, which is a hole that allows for the jugular vein to pass through. And close to it is the carotid canal. That allows for the passage of the carotid artery to deliver blood to the brain. I think I need blood to the brain. We can look at them from the inferior aspect internally as well. There's your jugular, okay? And the carotid canal is on the side of, oops, where is it? There it is. On the side of our temporal bone on the inside, okay? So let me give you a way to remember this. You know, sometimes you've got so much stuff to learn that if you put a little story to it, it helps to learn it a little bit better. So there's this bony structure in here, and it kind of looks like a mini mountain, okay? On one side of the mountain, there's a carotid canal, and you could hide in that. Come out of the canal, cross over top of the mountain, and you could hide in the internal acoustic meatus, okay? Come out of the internal acoustic meatus and slide down the mountain and drop through the jugular foramen, okay? So we've just taken a little hike over top of the mountain and sat inside the holes. Okay, moving on to the sphenoid bone. Sphenoid bone is really unique. It makes up a part of the floor of the cranium. It's shaped like a bat or a bird or butterfly, because of those funky wings that it has. And if I were to look to see where it's at in here, I kind of have to overlay this piece right there. So that's where it would go, is right inside there. So looking at the frontal aspect, if I look straight in there, I can see where that sphenoid bone would be. So you can see those slits right there. And that's behind the eyeballs, okay? So I said it looks like a bat or a bird or a butterfly, whatever, because of the wings. So this is the greater wing. This up here at the top is the lesser wing. And we've got a little saddle here. This is the sella turcica, okay? So I like to imagine that if there's a fairy, the fairy would sit in the sella turcica, and in order to drive this big bird, it needs to hold the optic nerve that comes through the optic canals. So there's one of the optic canals. So my little fairy would hold those and steer the bird from the sella turcica, okay? Trust me, it sounds corny, but you'll remember it later. What would really be great is if you come up with your own stories for some of these things. All right, another really unusual bone is the ethmoid bone, okay? And this one is also hidden in the skull. So again, if I look at the inferior aspect here within the skull, I see this part right up here at the top, and there's something sticking out. That's called the crista galli, and that's an attachment site for the membranes of the brain. So they attach onto that, and it helps to hold it in place. Then I see a space where there's a bunch of little tiny pinholes. That's the cribriform plate, and the foramina are the little tiny holes. So foramina is plural for holes. So I can look at the ethmoid bone as just a piece that's kind of exploded out of the skull. And there's the crista galli, okay? This, it would be my cribriform plate, and you can see all the foramina. This right here would be a portion of the perpendicular plate, so that comes straight down into the nose. And then I have superior conchae. Conchae is plural for conchka. Okay, so those are bones that are covered with membrane and allows for air to flow past in almost circular motion. Now, if I look inside the nasal cavity, I see that there's a divider. That's a septum. And the septum is part of the ethmoid bone and then part of the vomer. So the upper part is going to be the perpendicular plate of the ethmoid bone. And let's see, these upper things that are sticking out, those are actually the middle conchae. You don't see the superior ones when you're looking up into the nasal cavity of the skull. All right, let's see what's on the next page of our list. Facial bones. Okay, so all those that we just looked at, those were all cranial bones with cranial features. So now we're going to look at the facial bones. The maxilla makes up your top portion of your jaw where all of your top teeth are connected. The little holes or sockets that hold all the teeth are called alveoli, and that's plural. Alveolus is singular, okay? So all that is part of the maxilla. The palate, so at the top of your mouth, the roof of your mouth, it's hard, it's bony. That's part of the maxilla. And there's a line that goes down the middle of it. It's called the intermaxillary suture. So as you're developing in utero, those two sides come together and eventually they're going to fuse. They don't fuse until your late teens, early adulthood. And then there's another set of bones that's right behind it. These are the palatine bones. Okay, they're much smaller, but they also make up the hard palate. Zygomatic bone, right here out to the side, it projects. This makes part of your cheekbone, okay? So it goes from the zygomatic bone and it connects with this projection of the temporal bone, and that forms the zygomatic arch. Okay, so zygomatic bone, temporal bone, and they form an arch, your cheekbone. Nasal bone, that's kind of easy because that's where the nose is. Okay, so those top ones right there. Inferior conchae, okay, on either side inside the nasal cavity. And those are totally separate. Those aren't part of the ethmoid bone. The ethmoid has the superior in the middle, but the inferior ones are independent. They don't belong to the ethmoid bone. Okay, that septum that I mentioned earlier being part of the ethmoid bone, that continues straight down and connects with another bone called the vomer. So now you've got a complete septum dividing your nose. That's what can be messed up if you have what's called a deviated septum. So that septum is just off to one side or the other and can make it difficult for you to breathe on one side. That's what that is. Okay, and finally, looking at these bones for the skull, the mandible. The body of the mandible is all this down here. Comes to a point over here called your angle, and then it branches. So this branching portion is called the ramus. Okay, ramus means branch. This branching portion has two projections off of it. Has the coronoid process. Process is a projection. Okay, this is a bone that's projecting up. Coronoid means crow. So it's kind of like a crow's beak. You'll see that term coronoid in other places too. The other projection is the mandibular or the condylar process. So this process is a projection projecting that bone up to the mandibular condyle or the mandibular fossa. It will meet in the fossa right here on this rounded part, which is called the mandibular condyle. So condyle is just a rounded part of the bone, so it's smooth. Your mandible also holds a series of teeth within alveoli. So those are your tooth, the tooth socket. Lots of them, teeth sockets. Let's see, what else? One more thing, the mental protuberance is a bump on the mandible. Okay, this one doesn't have a real distinct one. It actually seems to have two of those on here. Okay, what else? Fetal skull. Okay, babies, before it's born, gonna see all the bones as they are very, very small and they're not quite fused together yet. Each of these places where the bones are gonna join, but they haven't fused yet, there's fibrous membrane that's connecting them together, and that happens at several places. Laterally, so this is anterolateral, lateral, and then posterior. So you can see those all the way around. Finally, we've got two other bones. The hyoid bone being unique in that it does not articulate with any other bone. It just supports muscle. And then the auditory ossicles, which I mentioned earlier. You've got 3 of those, and these are the tiniest bones of the body. The stapes, the incus, and the malleus. The malleus is attached to the tympanic membrane, and the stapes is attached to the oval window. Okay, have a great day of learning. What did I forget? Okay, super, thank you for bringing that up. The paranasal sinuses. So in order to see those structures, we need to look at either a coronal section or a sagittal section, okay? Because looking at just the plain skull, you're not going to see them. Sinuses are cavities inside the bone, okay? So within that bone tissue. You have maxillary sinuses, sphenoid sinuses, frontal sinuses, and ethmoid sinuses, which would be clear up here above the nasal cavity. And then, so that's why they're called paranasal sinuses, para meaning around. So all of those sinuses are around the nasal cavity. All right, now have a great day learning. Yay.